Good morning. Hello, everyone, and welcome to the HR Nonprofit Peer Group. I'm Julie Struble with Charitable Advisors, and today's presentation is on mental health strategies for diverse organizations. Mental health issues is a real and serious problem, and as an HR leader, you're aware that mental health issues can significantly impact an individual's well-being, their productivity, and really their overall quality of life. So at Charitable Advisors, mental health education has been our theme for the months of May and June. And we created a resource page that's called Focus on Mental Health. So this includes resources to promote a mentally healthy workforce in your organization. Also, just to assist the population that your organization serves, or it just might be some resources to help someone you know who is struggling. So if you have not checked out the Focus on Mental Health site, charitableadvisors.com, and then go to the resource tab. Additionally, in our weekly publication, the Not-for-Profit newsletter, we have featured our featured article has been on mental health throughout May and June. And as a leader, you will find some great suggestions in there. So if you have missed an edition, you could catch up. Just go to our website and then go to the newsletter tab to look at the past editions for it. So it is really our hope that these resources will help you create a supportive and inclusive work environment that promotes mental well-being. So for this seminar, we are issuing 1.25 SHRM CE credits to attendees. We've never done anything like this before. Oops, I'm sorry about that. We've never done anything like this before. And if we have emailed during this week and you've requested CE credits, I already have you on the list. But if you are here today and you want a SHRM credit, but did not email me previously, then please send me a message in chat. Just make sure that your name is in the Zoom box, and I will be sure to get you on the list so you could get a certificate later. So I don't have a lot of announcements today. So with that said, why don't we go ahead and move on to introduce our presenter, Jamie Behrman. Jamie is with HR Elements and partnering with Von Lehman CPA and advisory firm. She comes to us with over 20 years of strategic human resource experience, from large-scale trainings and performance management programs to providing on-site HR support. Jamie's goal is to provide her clients with the tools and strategies they need to effectively create a culture where employees and business thrive. Jamie, it is so wonderful to have you here today.
Thank you. I will go ahead and share my screen and then we will get moving. Sorry, there's boxes popping up. All right, we should be good to go. All right, good morning. Thank you, Julie. I am very excited to be here with all of you this morning. Like Julie said, we're here to talk about mental health strategies, but I really wanted to focus on mental health with a diverse organization. Because one thing that we've learned over the past few years, pre-pandemic, when we were starting to even just see millennials coming in, and we're still talking about all of the different generations, as well as different types of people, is mental health is not a one fits all strategy or a solution. So that's really what we're going to be looking at and talking about this morning. So first of all, I always like to start with a little bit of humor, but how many people can relate to this feeling? Everything's fine. I'm great. So it's that never knowing exactly what's going to happen. Oh, excuse me. We're having a moment right now. No, you are not. No, please leave.
Okay, sorry.
I am having this right now in my home, so I apologize. Best laid plans, managing stress, managing the unexpected. It's part of all of our lives as humans, but as HR professionals, not only are we managing it for ourselves and our organization, but we're trying to figure out how to help all of those individual humans where we don't know exactly what's going on in their lives. So when we think about mental health awareness, it's pretty staggering. So nearly 1/5, so 19% of US workers, so this is just workers in general, are struggling with mental health. One of the main results of this struggle is absenteeism. When things aren't going well in a person's home life, in a member of their family's lives, or they're just struggling personally, it's hard to have that giddy up in the morning and make it into the workplace. So 4 out of 10 US workers, this has had a negative effect. Performance is down, employee engagement is down, which really leads to a decrease in business profitability and overall business results. And really, the main issue that we're seeing is we want to, as an HR professional, as a manager, deal with the actual absenteeism issue, right? As HR people, we're not trained to go and say, I noticed that you've been absent. Are you having a mental health problem, right? That's not what we do. So we're trained to handle the business issue absence, but being able to also communicate and provide resources in general for possible issues like mental health is what we need to be proactively doing. And 50% of US workers, they don't have access to support, which means maybe the support is only available during work time. Well, can't leave work in order to get that. I'm going to get in more trouble. Or they can't physically get there. So lots of different challenges that we need to handle and talk about as HR leaders. So when we look just at the unplanned absences, this is a pretty big deal. So people who are reporting their mental health as either very good, good, or fair, so 34 for good, very good, and then 16 for fair from a percentage perspective. Look at those absences, 2.5 missed work days per year, right? For excellent, very good, and good. And then we look at that orange and red, which is fair and poor, is 11.8. Like that's pretty staggering. And these are not vacations. This is not PTO. These are unplanned, spur of the moment absences. So I think this chart really just highlights the fact that when somebody is struggling with mental health, it's not just a personal crisis, if you will. It really is a business or an organizational impact that really trickles down. So when we think about the overall case for mental health awareness, why should we even care about this? Is that there are true economic costs that are going to come out of this. So one, we're going to see poor physical health overall. And I'm going to talk later on in the presentation about physical health and physical well-being in conjunction with mental health. But we see this in people have to caregive. There's going to be depression, poor sleep, obesity. All of these things lead to additional either economic or even business costs because we're going to see higher claims from a medical insurance perspective. Smoking, as we know, people may tend to utilize tobacco, even alcohol when they're struggling with their mental health. Well, that's a cost to purchase those products, but there's also then other types of issues like safety, potential accidents. Maybe we're going to be talking about rehab, but also the biggest driver of additional cost when we think about mental health. And this isn't treating mental health, this is side effects from poor mental health, is those medical claims costs. It really just skyrockets. And I'll mention that as a caregiver, a couple of years ago, our teenage son indicated that, he needs some help. Well, one, how lucky are we that he communicated that to us? But as a caregiver, trying to find resources, and at that time, the resource we had most readily available to us was an employee assistance program. Wow. We'll talk about those a little bit more too, but they're not as accessible and robust as maybe we were trained to think in the early 2000s. 20 years ago, if you needed help, you could call your EAP and wham bam, you were getting something that you needed. It's so over utilized now that these organizations are struggling. As the caregiver, I had to spend probably a day and a half just trying to secure an appointment for our son to go in and have somebody to talk to, because it was a non-emergency. It ended up that our best option was to just go outside private pay on our own, because we could get that immediate access, but that's not the position that everybody else is in financially. So, it really is a systematic challenge. So when we think about mental health, and then DEI, diversity, equity, and inclusion strategies, we need to be looking to support health proactively. And that does also include mental health as a DEI strategy in and of itself. So when we think about groups or people who may be struggling, they do tend to get marginalized. So typically, when we think about a marginalized group, we're going to think about a minority from a race, maybe a gender identity, even an age group perspective. But folks struggling with mental health, they're in their own marginalized grouping as well. Because if you think about it, the picture that hopefully I've painted for you so far during this presentation is that they're struggling with their job. They're probably struggling with other economic issues because of that job struggle. Maybe they're having a hard time just at home in general. So they're really in a group all by itself. So we're going to look at mental health and diversity, what really that true connection is. So a lot of businesses and organizations are talking about how they're committed to diversity. But what that really means is ensuring that employees, all employees, have access to support that they need from their peers, from leadership in the organization, support services like those EAPs, as well as health providers. So looking at the actual medical plan that you have. How many mental health visits does it include? That sounds a little strange, but I've seen a lot of healthcare plans where it's like, oh, you get 4. Well, 4 might be enough to just talk about maybe what the issue actually is. As far as a treatment strategy, that's really not very helpful. And again, that's not going to provide a long-term solution. So when we think about work impacts on the well-being of employees, we're going to see maybe some microaggression towards these different groups, just general lack of representation. We're not thinking about mental health as a strategic business strategy typically. leaders aren't always addressing this as an issue or a platform within their business. We see that unconscious bias. We talk about it a lot, but just thinking about offhand comments sometimes, like if somebody has let's call it an emotional outburst, how often as HR professionals might we hear that they say, oh gosh, someone's going crazy? You know, it's just that unconscious bias, not, wow, I really wonder what that person is struggling with and how to approach it. And there's continual other stressors that are going to make this overall diverse approach more challenging. So it's not a one fits all solution. But what makes it worse is there's racial and ethnic disparities when we look at just addressing the mental health crisis in general. So when we look at minority groups, they're impacted on a higher level and they're less likely to use these services because of the treatment, right? Typically, you want to have a connection, build that trust, build that relationship, even just have that compassionate approach when you seek out help. So we're seeing a lot more harmful experiences for these minority groups just because of one, cultural, but also access to service. So Asian individuals are 51% less likely to seek out treatment. Latinos are 25% less likely, and Black individuals are 21% less likely. One, it's from general representation in the treatment arena, even being able to approach and say, I need this help, but it's also cultural acceptance. What is approached from their communities, their families, their experiences may also be different than what we see from a European, white, Caucasian approaches. So when you're looking at a DEI strategy for a business in general, it needs to, one, of course, address the age, the race, the gender identity, but also with an overlay of mental health support. So other diversity disparities that we should talk about is things just impacting some groups that are going to lead to a higher prevalence of mental health concerns. So if we look at racial or ethnic, as well as a gender or a sexual minority, they generally have poor mental health outcomes. One, we just talked about how maybe certain groups are less likely to seek treatment, but also when they do have treatment, if they do take that first step and have that access, if it's not the right fit, if it's not the right approach, they're not going to continue with the support and the outcome isn't going to be effective. There's also inaccessibility of high quality mental care. So this is something that I was talking about moments ago on a personal level. Paying out of pocket for healthcare, mental health, whatever it is, it's not easy. It's something that is a very high cost. And it's typically not something that we see people, one, budgeting for in general. So if it's a burden to, one, get that EAP support, because that's all your organization is able to offer, you're going to have time off from work. You're going to have to spend time during business hours trying to seek access, get that support, but then you may only get 3 visits. What is that end result really going to be? So it's completely unaffordable. Also, previous slide, we talked about those cultural stigmas. When we think about that number that we saw for folks of Asian descent, 51%, that's more than half of people who aren't going to seek out treatment if they really genuinely need it. They're going to suffer in silence because from a cultural perspective, that's not okay. we want those different cultures from a workplace perspective to have that openness and acceptance and discrimination in general against those, who may be suffering from a mental health issue. It's when I talked about the, marginalization of these folks. It happens outside of the workplace, but it also happens inside the workplace. These people are struggling. Others aren't tending to seek them out and understand. So they're again alone. And it's really due to a lack of overall awareness about mental health and fear from us as business leaders about how exactly to approach it. It gets uncomfortable if somebody comes into your office, even if you are an HR professional, starts telling you all of their struggles, right? Because it's that separation of church and state. From a business perspective, we want to have that separation of work and medical information. What's that boundary? So we're going to talk about strategies to help us get there. So then I wanted to also pause and think about just overall generational differences. So we've talked about race, we've talked about gender, so generations. So when we think about the Gen Zs, right, they prioritize mental health. These are the folks that we've all been told in the interviews are going to be asking about, well, tell me what mental health resources you have. How many additional PTO days do you have for, a mental health break? I know that, my son, who disrupted us a few moments ago with questions I answered for him this morning, he has brain break at school. Like, that's literally about mental health. He is being trained to take these mental health breaks to, shake out his sillies. But if he goes into a work environment in 20 years and he doesn't have his brain break a couple times a day, I could see that being an issue because that's how we've trained them through school. But then we look at our workers who are 40 to 59. So this is where we're seeing those highest increases in stress, anxiety, feelings of negativity in 2021. Well, that kind of makes sense, right? This age group is probably in those highest ranking positions now. New jobs, obviously that COVID overlay, there was a lot that we weren't trained to think about and deal with. And we're also planning, for the future, stepping into a new role. I look at my husband, he's in this group. He has recently been promoted into a leadership position at his job. And he said to me the other day, like, oh, Jamie, oh my gosh, like, I love my job. I love what I do. I love my company. But I have never been more stressed out in my entire life because it's a whole new world of work. It's a big deal. So when we think about also our people 65 and over, our retirement population, hopefully, right? These older workers are soon going to be the fastest growing segment of the workforce, and it's going to continue, that they're exiting, they're planning their retirement. But if those folks are still in our workplaces, they're probably stressed for a different reason. And it's because they haven't been able to retire. So stress, fear, anxiety, a marginalized population, that's going to have an impact on that mental health. So as an employer, what really should you even start doing? Well, one, we want to figure out some type of health check and counseling for employees. So this is like a baby wellness program, if you will. Just having that health check, having different resources that you can roll out for people to do at their desks, even to just take a moment, pause, and think about how am I doing? And even offering counseling for employees outside of an EAP. I've seen some organizations that have said, we know we have an issue here. I had a client where their employees, most of their employees were under the age of 35, lots of young people. And we were having a significant number of mental health, anxiety, I shouldn't call them mental health, but depression and anxiety medications on our benefits plan. it was like 1 in 3 employees were utilizing these prescription services, which good. They're obviously talking to somebody and getting some help. But as a business, we wanted to know what we could do to maybe save some money and provide an additional resource and outlet. Maybe there were other people in our workplace that weren't seeking out care but needed help, because this was a pretty staggering number. So we were able to partner with local medical center. It was actually UC here in Cincinnati, where they had a workplace program where they would come on site. We were able to have a different floor of our building where people would work, excuse me, directly with that UC provider to schedule an appointment. They would just go, they would take a break. We had it a couple of days a week. So it wasn't, like, oh, Joe, they're out of their cube. They must be having their mental health treatment. But it worked really well. People were really comfortable. And for those employees who maybe weren't comfortable going downstairs to a different floor, meeting in a nebulous, conference room, they could still get the treatment the business was providing by going directly to UC. So we made it work. And we, as the business, had no idea who was utilizing the services. We just knew the numbers so that we could obviously pay the bill. We also want to look to mitigate ageism and really address that unconscious bias. And that's outside of a specific focus on just mental health. That is a general focus on training on unconscious bias. It's bringing that awareness of what might I be doing, or what may I have been brought up thinking, because that's how my parents talked to me. That's what I saw in my environment, that has created a bias that I have no idea about, so that I can be more open and aware as a leader, as an HR professional, as a colleague, to assist people. And also kind of this preventing burnout, thinking about my 9-year-old preventing his burnout during the day because he has brain break. Well, all right, what do I need to do as a 40-year-old person to prevent burnout on my own? Do I need to make sure I stop working at lunchtime, which I never do, and take my dogs outside? Do I need to call my mom and have a chit chat with her just to decompress for a couple of minutes? I was raised by a dad who worked. And so for me, once I start work, I don't stop until it's literally like the end of the day and I have to get up and leave. So I need to physically prevent myself from that burnout. And it's not a natural thing, but I have to do it. So as an employer, acknowledging it and addressing it and saying, hey, how many breaks are you guys taking a day? The opposite of what we're trained to think is going to really help us. Just a strategy, and that doesn't really cost money. So we think about caregivers. Maybe we have an employee who's fine. They're not struggling with an obvious mental health challenge, but that parenting, excuse me, parenting stress. So that can really take a psychological toll on them, in addition to addressing the health of their child. So that can be a major risk, but also, depending on those age of the children, it could potentially lead to some mistreatment of just their situation, but even maybe a punishment when a punishment isn't needed because of that break. And it really is a rise in mental health crisis. For the rise of the children is causing an issue for your employees. They're missing work. They're maybe not engaged when they're there. It's hard to think about work when you're worried about your precious child. And about 1 in 3 adults provide care to other adults as informal caregivers. So this could be a spouse, a partner, a friend, that we're signing up to provide care to in addition to our children. That's a lot. And so those caregivers, those parents included, we're really at risk because we're neglecting our own needs when we're trying to provide the care for our others, our children, our friends. So, excuse me, what I want to think about is the difference also between well-being and wellness. So we've talked about mental health, but then how do we measure that? And what does it really, really mean? So well-being and wellness, they're not the same. So when we think about well-being, and it's not something that we talk about often, and we really need to. So it encompasses the holistic dimensions of your overall life as a person. So your body, your mind, your environment, financials, those are all pieces of a robust wellness program because it measures an employee's overall well-being. So as a professional in your career, do you like what you do? Are you happy at work? Do you feel welcome? Are you connected? Kind of a good indicator of an overall company culture too. Career well-being. So then we think about our social well-being. Do you have friends? Are they meaningful relationships? In general, are you connecting with people when you're not at work? Financial, are you able to manage your money well? And again, that physical, how is your body feeling? And that is what we talk about with wellness is physical. And then again, community. Do you feel safe? Are you secure? Are you connected to the place where you live? These 5 things we don't always measure and talk about, and they are really what tells us as humans, are we okay? And they're all not going to be in line at the same time and together. So, and I apologize. I don't know if it's that fiery weather that we're having, that smog, but I am really having a tough time. I apologize for all the throat clearing. So we think about what the difference is between the two. Again, well-being is how am I in all of those different buckets. I've done a bucket exercise before, and your well-being can change by the day, by the week, by the hour. If you get slammed with a big bill that you weren't anticipating, well, maybe your financial well-being was great when you woke up this morning, but oh man, it's 4 o'clock now and I didn't realize that bill was going to hit me. That's not what I was planning on. These things can change throughout the day. And as an employer, that's where we may see people's overall engagement, their commitment to just productivity, and their stress changing during the day. So that wellness is an element of overall well-being. It's that physical piece. But really, when we look at well-being, that's really that mental health piece that we're talking about here. And it does include physical. And when we think about large employers, right, they have pretty heavy pocketbooks. 85% of them, they're offering a workplace wellness program. So that's where, maybe they're giving out a Fitbit to track those steps. When you think about wellness, you may think about eating healthy. Exercise is obviously a big one. But the missing component in that is mental health services, mental health exercises, mindfulness challenges as part of that workplace wellness program. And that's really what we need to change. So when we think about, again, the importance between wellness as a measurement, but overall well-being, it's when we would do a survey, US adults who are thriving in all 5 of those pieces, right? They're great with their well-being. They're typically only thriving physically. So the people who say, I have a good wellness, right? Physical well-being is wellness. 68% of them who are only having physical wellness miss more work each year just due to poor health, right? So maybe physically they're thriving, but gosh, they're really stressed out about money, or they're depressed because they have zero social life. They don't have that connectivity to others. So they're still missing work. They also are more than 3 times likely to file a workers' compensation claim. So they're having some type of incident or injury at work. And obviously that's going to be a huge cost. 5 times more likely to seek out a new job. Well, that's pretty obvious if they don't have that career well-being, where they're happy and fulfilled, they're getting that intrinsic value from their work. And they're more likely to actually change employers. So 2 times more likely, which obviously that's going to lead to absences if they're seeking out those new employment opportunities. So having a well-being program at work, that's the new wellness focus that we need to have. We need to help our employees thrive within their lives. And we need to remember that work and life, they're not mutually exclusive. If you have a really bad morning, you're probably not going to walk into the workplace bright-eyed and bushy-tailed and ready to do a good job. You're going to walk in a little bit like Eeyore, and your stress level, maybe your tolerance, it's probably all going to be impacted. So we need to realize, and I always say to managers, like, yes, we're managing employees, but we need to remember that we're managing humans. So how do we do that? How do we put that human essence and element into it? So acknowledging that work and personal really do blend together a lot. And the more elements of well-being an employee thrives in, the better. So thinking about those different pieces of well-being, career well-being, making sure that we're promoting social activities, as well as financial wellness, in addition to just physical, which we talk about a lot. That's going to really drive results. So we're now going to transition into some strategies. So 10 really high impact strategies that organizations can take is, one, to promote and destigmatize company EAPs. When I originally worked for an organization and we were talking about the EAP, I was only talking about and promoting the counseling pieces of it. But a lot of EAP programs will help an employee connect to resources in their community. Maybe they're having a tough time finding daycare. Maybe they're having a tough time finding adult care for an aging parent. They need a will. They need help making a budget. They need help connecting to a bank that will provide them the lending that they need. Those are all things that EAPs can do. So instead of talking about the EAP only during open enrollment and only talking about it during the healthcare portion of your benefit presentation, talk about EAP in a weekly news blast. Send text messages to your employees about it if you can. Make sure you're talking about the EAP on the employee intranet and not just about the counseling. Having lunch and learns that your EAP will help facilitate for your employees during the day on different topics that aren't really embarrassing. I don't think people are embarrassed to say, well, gosh, yeah, I really love having a robust financial plan. The EAP can help with that. But also look for ways to expand these offerings that you do to family members. So if there's a walkathon, if there's a financial wellness class that's happening, do it outside of work hours. People will stay if it's something they're interested in and that they need. Allow them to bring a +1. It can help drive that social well-being, as well as the family well-being. And again, we're seeing sometimes access to food being a challenge. If that's a problem in their home, we're seeing vending machines being changed to more healthy food options. That can just be a nice offering if you do it. And again, so we talked about a couple of these finances. One issue that I struggle with, and I've seen some clients do it, is where, an employee will come to them and say, I'm having a tough time affording X, Y, or Z. And instead of helping that employee get a financial class, right, or seek out some financial counseling, they'll give them a loan. well, that's just going to help them dig into the hole. It needs to be a combination of a couple of things to, again, treat the problem and prevent it from happening down the road. And one of the best ways I see organizations, and this is my favorite thing as an HR professional, because something I might find really awesome and important isn't going to necessarily lie the same with everybody at the workplace, is make it a committee. Have employees participate and lead these strategies. They're going to be champions among your employee groups that, one, are going to help maybe destigmatize it. If it's not being rolled down from HR, maybe it's being rolled out across the organization. There's going to be more just bottom line communication, and employees may be more excited about programs that are a little bit more accessible for them. So also recognize employees for their well-being achievements. So this is something that, is probably going to be more of a participative engagement. But when we think about those buckets, what are employees doing to address, hey, I've been feeling really, stressed out at home. So here are some things we've done as a family. We have a game night here. We do this, we do that. Just talking about it and promoting those ideas and recognizing employees when they want to be recognized, when they're okay with it, can really be a free but impactful solution, because it's, again, destigmatizing that. Helping employees find safe places to exercise, incentivizing them to do so. It really does have an impact on mental health, to just be able to get outside and decompress. Cooking classes have been something that people have liked as well, and making well-being a part of your annual goal setting. So bringing it into performance management, having a conversation with your employee on a regular basis to just say, how are you? And maybe talking about different pieces of that well-being, those 5 different categories, making sure it's a part of thought and a checklist, even for employees on a daily basis, having a simple cubicle or desktop wall hanging to know how you're doing with your different buckets. I did a wellness program with a client where we talked about, things like, where do I need some rest? And do I need rest from work? Do I need rest from, social? Why do I feel tired in certain ways? And I've seen so many different employees that have kept that hanging up in their cubicle, because maybe at 2:00 in the afternoon, they're feeling tired, but it's not because they, ate lunch and it's 2:00 in the afternoon. Maybe they're burnt out from their workday. Maybe they need to get up and take a walk. Maybe they need to go down the hall and chit chat with a coworker that they're friendly with. So we really do want to promote those programs and just that thoughtfulness. Inclusive mental health, again, thinking about that DEI component. So we want to look at mental health and inclusion. So if you're having a partnership with an organization that can come in and train your employees on, let's just say, mindfulness or financial well-being, let's make sure that it is representative of the employee population and not just somebody that people may or may not feel connected to. We need to make sure we're bringing it to everybody's level. And maybe that means you have a few sessions, and that's okay. We need to educate and empower our managers. Managers have a tough job. They're watching the attendance, they're watching the performance of their employees, and they're probably the first people who are going to be able to say, something's different, something's off. And instead of just training managers to address it by reviewing the attendance policy, let's remember that human component. What are those feedback strategies where, yes, we're telling our employee that it is important that they come to work and that they be there on time, but how are things going? I've noticed you've been late a few times. What's going on? How can I help? open-ended questions to maybe draw a little bit out from that employee so that we really can help them achieve well-being in wherever they're struggling. And again, moving from words to action. Once we say something or we ask the question, we really do need to circle back and follow up with that employee. We need to be able to do a survey. And if people say, yeah, I would love having some financial classes, we need to give them what we've asked. So some other action steps that you can take now. So one, listen to your employees and encourage dialogue around mental health. A great way to just start the conversation is by doing a survey, a well-being survey, to find out, what do employees even think about their well-being right now? How can we help them? Ensuring access to effective care. This is something your benefits broker can help and do for you, but then you need to communicate it out to employees. Talking about benefits, talking about what your plans offer has to happen year round. Doing little benefit lunch and learns, making sure you're teaching employees how to use your benefits is really important, and people will pay attention. We often forget, we enroll and then we walk away. Also, offering those solutions to dependents on the plan. Maybe it's more of like a teledoc for mental health, where it's not just the member that's on the plan, it could be anyone in their household to get that access. A lot of EAPs work that way. Same thing with those mental health care teledoc options. It's anyone in the household to get that safe place and that safe treatment. So employees don't typically go home and say, oh, I got this flyer at work today, honey. Let's talk about it at dinner. So mail it to the home. Remember who's seeing the mail. It may not always be your employee. It may be somebody else. It might be a child that likes to get the mail every day, hoping that they got some type of letter. Maybe there's a program that's just sent out to the teens or the younger children, talking about things that they can do at work with their parents. And again, give managers some training on mental health to just be aware. Give them conversation starters so that they understand what exactly I should say when an employee comes to me and says they're depressed. It can be really uncomfortable if your manager isn't properly trained, and there are a lot of programs available. And just design better work. Design breaks, design acceptance in your culture, in your workplace, to just have a moment to breathe. So utilizing communications is easy, but you have to make sure you have a portal that employees are using and that they trust. And again, frequently send things out via email, but bulletin boards, restrooms are a place that you should use to communicate information to employees. Feels a little weird, but pretty much everybody uses the restroom at work, especially if you're physically all together. Putting up flyers and sharing information in there is great. EAP posters should always be in the restroom. And again, have a safe place for employees to come forward. Does that mean it's a text message that they can reach out for help? Is it a secure, anonymous email that goes to one person where they can provide a phone number, or just a location where they can get free resources without having to ask for help? We don't want to keep that EAP information only with HR. We want to make sure it's something an employee can seek out on their own, individually, maybe even when they're at home. And then promote the self-care. We want to make sure that we are having employees use their PTO. So while sometimes maybe you can buy it back from the company, will buy it back from you and you get a bonus if maybe that helps from a financial well-being perspective, but having time away is important. Making sure employees have backups and aren't stressed when they're off on PTO is important. And it's really important for managers to set the example. When you're on PTO, do not work. When you are on PTO, do not engage. Be on PTO. And I am actually saying this out loud to remind myself right now because I'm awful at it. But I did it this March, went on a cruise, and I didn't work. And I had a backup, and she did everything for me while I was gone. And I will always be able to do that now. And it was absolutely amazing. And it was great for my family. Um, but the other piece of it is, when we go on PTO, we're so worried that somebody's going to reach out to us and need something. As a manager, if you have a person who's out, of course, you're going to think of things for them during the week, but maybe do a delay send. That email is sent to them after they return. You won't forget it because you can write it in the moment, but it doesn't matter when it gets delivered. You can do a delay send so that it arrives when they've come back from vacation, just to allow that space. And ask employees and encourage that they check in with their families throughout the day. We think about cell phones on the shop floor. Well, okay, yeah, if you're trying to run a machine and you're looking at your cell phone or you're texting, obviously that is dangerous. But making sure we're having just breaks, or hey, you need to check in with your kids, you need to call your mom, whatever it is, fine. Here's the safe place and the acceptable area for you to do that. And just change things up. Have walking meetings. Have a mindfulness time period. Have a mindfulness area. I even saw a client with just a mindfulness room. It wasn't fancy. It was a room, and it had some comfortable chairs in it and just some tips on the wall for mindfulness. Multiple people could go in there at a time, and it just communicated acceptance. And that was wonderful. So when we think about mindfulness, what exactly is that? It's a mental state when you are aware on the moment right now. You're calmly acknowledging and accepting your feelings. You're learning to understand what your feelings are. You can name them. But it also can calm maybe tension in your muscles and your body. And it really is used as a therapeutic technique. Being able to adopt those strategies during the day, again, it's a nice free solution. It's something you can communicate and teach your employees about, and remind them to do it during the day. Mindfulness doesn't take a long time. It's just a quick brain break, if you will. So there's 3 components. One is that intention, attention, and attitude. So being kind, being curious, non-judgmental. We don't know what other people are doing. So it really does help mindfulness from a DEI strategy, because it's accepting, it's calming, and it's individual. So there's 6 mindful exercises. So breathing, mindful observation, just sitting back, looking at what's happening, observing your whereabouts, mindful awareness, mindful listening, immersion, and then appreciation. So these are all topics that you can try. They're my little exercises. I like to do them with teams, voluntary. Come to a lunch and learn. We can practice mindful breathing together. We can practice mindful listening. That is really important, especially as managers, as HR people. I think that mindful listening is so important. And that, again, that mindful appreciation is another one. These are 6 exercises that can be done anywhere, anytime, and they just cost a few minutes. So I want to go over a couple of resources also that are available. So the National Substance Abuse and Mental Health Services Administration, that's really important, especially if you suspect that maybe we're seeing some mental health issues, but a lot of times we see that crossover into substance abuse as well. So it's a great resource to call. They might also come out, be able to do some training, or even send things to you. We have the Department of Mental Health and Addiction Services. I have Ohio here, but every state does have one available. Even your local health departments will provide resources to you, so don't forget about them. The National Alliance of Mental Illness, they have some great information, but then also at that county level, even sometimes the United Way can provide some great resources. And then just some different behavioral health departments. Your local universities, those major health systems are always going to have those available. Excuse me. And again, as a nonprofit, typically I can find that they'll donate time or provide some type of really good discount, but also go together as a group for resource sharing. Have different local events where you can go together with a couple organizations to do a mindfulness walk, or have somebody come out to do a seminar. It will be really beneficial, and it can also connect more community well-being. So with that, we'll go ahead and move to any questions. I don't know, Katie, if we've had any in the chat.
There have not been any in the chat.
Okay, great. And I know we're almost at time as well.
You know, Jamie,
Yeah.
it might be great if anyone would like to share things that are working in their organization. I loved what you had to say, and that you have just really brought up so many original ideas, and that got me brainstorming. And a couple that come to my mind would be having one-to-one meetings on a regular ongoing basis with the manager and the team member. I think that we get so caught up in having these team meetings that are focused around agenda and the performance and problem solving. And then just having a kind of a more of a, a one-to-one meeting, and we're coming really not with an agenda, and giving them the opportunity. And these have been times that I have learned, oh, you have an elderly parent, and they're on the decline. Oh, now you're putting your elderly parent in a community, senior community center, and being able to work with them in those situations. So definitely, I thought that was really good. And then something that you brought up that I think has had that we don't think of in mental health, but has had a huge impact, is the cross training. Because in these smaller shoestring budget organizations, it's easy to say, well, Sally does the payroll. Well, when Sally's on the crew, she still has to process
Yes.
payroll. And that has had an enormous impact in just saying, go, take this week, take this 2 weeks off, and decompress and come back refreshed. And when you come back, you don't have a month's worth of work to do because it just piled up.
Yeah.
I love that you brought that up. So
Thank you.
so I know we're getting close to the bottom of the hour, but is there anyone else that would like to share? Well, again, thank you for the resources. Please feel free and go out and check out our Focus on Mental Health on our Charitable Advisors website. And if everyone could please extend a big thank you to Jamie. Jamie, this was a very difficult subject, and I was amazed with the real life examples that you gave, and how practical and original this information is. This is not like any other webinar or workshop that I sat through, that this has a whole bunch of nuggets for us all to take away. So thank you so much. And everyone, will keep you posted when we're going to have our next HR nonprofit peer group, and have a blessed day.
Thank you.